Hey everyone, welcome back to Blueprint Nursing NCLEX Reviews. My name is Nicole and we're going to do a practice NCLEX question and flex our cardiac knowledge. Let's jump in. Here's the question. The nurse is caring for a client suspected to have left-sided heart failure. The nurse would expect this client to experience which of the following symptoms? Select all that apply. Here are the options. Ascites, cyanosis, dependent edema, exertional dyspnea, jugular vein distention, tachycardia. But what do we know about each option? Let's go through them. Ascites is what? Well, ascites is the collection of fluid in the peritoneal cavity that is caused by portal hypertension, severe liver damage, or low albumin. These clients will have distended abdomens on assessment. Next up, cyanosis. Cyanosis is it's the bluish discoloration to the skin, nail beds, or mucous membranes. This is usually an indicator of poor oxygenation. I try to think of the color cyan, like the word cyanosis, which is a bluish color, to remember this symptom. On to dependent edema. If we look at this option, we notice the word dependent in front of edema. Well, we know edema means swelling, so what is dependent edema? I want you to think of our clients that are going to be sitting at bedside with their legs dangling and no foot support. What might happen with their legs? We might see some swelling there, some edema. So, it is the positional accumulation of fluid that usually occurs in the lower extremities. Let's move to exertional dyspnea. What are you thinking here? When we talk about exertional dyspnea, we want to notice exertional. So we're thinking of our clients that are walking back from the bathroom a little bit out of breath. It's the difficulty breathing related to physical activity. Ready for the last two options? We have jugular vein distension. Jugular vein distension is the swelling of the jugular vein, which runs along the carotid artery. This is usually indicative of what? We're thinking poor blood return to the heart. Lastly, we have tachycardia. Tachycardia can be a pretty vague symptom, but we want to consider it in relation to left-sided heart failure. Would this occur with left-sided heart failure? I'll let you think about it for a little bit. So, we know that the left side of the heart receives oxygenated blood from the lungs and pumps that oxygen-rich blood to the body. Let's think. If the left side of the heart is weak, where will circulation be affected? Well, circulation is going to back up to the lungs, which means impaired gas exchange and pulmonary edema. And the heart will struggle to adequately supply oxygenated blood to the body. So now that we pulled our knowledge of left-sided heart failure to the front of our mind, and we went through each of the answer choices, which ones will apply to left-sided heart failure? I'll let you pause on this question again, think about some answers, and then get back to me when you're ready. You ready? All right, if you answered cyanosis, exertional dyspnea, and tachycardia, you are correct. If you chose the other options, that's okay. This is what practice is for. Let's take a quick breath and then walk through some rationale. Okay, with this side, we're going to use this image. It's going to be a great visual for discussing rationale. If we look at our correct answers, we notice that each of these are due to poor oxygenation and perfusion. Cyanosis would occur with left-sided heart failure because the left side of the heart cannot pump enough oxygen-rich blood to the body. This client will also be experiencing exertional dyspnea because of the impaired gas exchange in their lungs. Lastly, tachycardia would present because this client's heart is trying so hard to compensate and deliver as much oxygen to the body as it can. Pulmonary congestion and decreased cardiac output are going to be why we're seeing cyanosis, exertional dyspnea, and tachycardia in this client. This client's body wants oxygen. Did you notice what the other options were symptoms of? Are we thinking right-sided heart failure? Absolutely. Let's talk about it. When the right side of the heart is weak, the vessels that feed into the heart will also be affected. This looks like an increase in pressure of the portal vein, the mesenteric vein, or the jugular vein. With each of those veins affected, you will see symptoms of liver damage, or ascites, fluid accumulation, dependent edema, and jugular vein distension. Right-sided heart failure will affect blood flow from the superior vena cava and the inferior vena cava, which are both veins that bring deoxygenated blood from the body to the heart. That's why we would see the effects of liver injury, fluid imbalance, and jugular vein distension. Well, that's all I've got for today. Thank you so much for hanging out with me, and I hope you come again soon.